Good morning, everybody. Welcome to the RCN webinar. We're just gonna wait a bit for everybody to trickle in before we start. We'll get going at not 5:01. It's 5:01 where I am, so we'll get started at 1 after the hour. Okay, we're gonna go ahead and start and make some announcements before we begin. So welcome to the Wastewater Surveillance for SARS-CoV-2 and Emerging Health Threats webinar series. This is our webinar for the month of May. We're excited to have two amazing scientists here to tell us about their work. We're going to hear from Marisa Eisenberg from University of Michigan about her work at the intersection of wastewater-based epidemiology and public health. And I think her title has changed a little bit, so I won't even say her title. And then Marlene Wolfe, who's a professor at Emory University, is going to talk about recent work on avian influenza markers in wastewater. As a reminder, we have a monthly journal club, which you'll be getting emails about. We have webinar nominations and an email list. If you'd like to learn more about these, please email one of us. And then just a reminder that we have one more webinar for this academic year. Next month in June, we'll have Masaki Kitajima from University of Tokyo talking about wastewater surveillance at airports, and Danielle Lantang talking about work in low and middle income countries. So with that, I will stop sharing my screen, and I'd like to introduce Marisa Eisenberg, who will be our first speaker today. Thank you so much, Marisa, for agreeing to talk.
Thanks for having me. This is wonderful. I'm excited to chat with you all, and hopefully we can have some good discussion. So yes, I'm going to talk a little bit about, I don't know, actionability, public health practice, those kinds of questions, and sort of how we think about that. And I'd love it if we could, I'll try and keep this to, strictly to time if I can. Love it if we can kind of talk. I think everyone probably in the audience, many of you have also had experience with this kind of thing, and it would be fun to connect and talk back and forth. So oh, sorry, there's a raised hand. Is there something, or we're okay?
It's fine. Yeah, I'll moderate any raised hands.
Okay, great. So, perfect. Okay, good.
Yeah.
Okay, so our group, this is our group is a collaboration between Krista Wigginton, Michelle Ammerman, Betsy Foxman, and myself as the sort of PIs, and then a much bigger team of folks, students and staff and different folks who work with us. So a lot of the stuff I'm going to be presenting is from that group and that team, and as well as from our public health partners in our local health departments in the counties that we work with and at the state. And so just before I even get started, I just wanted to kind of mention that. So our broad group does wastewater monitoring in Southeast Michigan. We have 5 sites across Southeast Michigan with a wide range of sizes, from teeny tiny in Tecumseh all the way up to 330,000 people in our Ypsi site, our Ypsilanti site. We monitor a number of different pathogens, and some that are public and others that are sort of in progress and are currently not yet. They're sort of being designed, but so that's kind of the sort of bread and butter of what a lot of our group does on a regular basis. We sample from the 5 plants, collect twice a week. Some of those we do as influent and others as solids, and then ddPCR and reporting. And so we have a dashboard. If you all want to check it out, there's the link. We do kind of similar to scans tertiles and things like this. We have quartiles, but so levels, and then we adapted the CDC trend for SARS-CoV-2. So levels and trends across all the sites and the various different pathogens. And where possible, we try to provide, so this is kind of transitioning us into the actionability thing, we try to provide corresponding data so that can give us a sense of what's the clinical or public health picture of what's going on. So here's influenza A, and then at the county level, the percent of inpatient beds with influenza patients, so you can kind of start to compare. So that's sort of a little background about sort of what we've been doing. And what I want to kind of talk about today, to get to sort of actionability, I thought I would sort of talk a little bit about, we try to stay pretty closely connected as much as we can with our state and local health departments. And so, we have monthly meetings and regular update emails that go to our stakeholder group. And our stakeholder group includes the folks from the wastewater treatment plants, local health departments from the counties that our treatment plants cover, our sewer sheds are contained in. And then the Michigan Department of Health and Human Services, as well as like other organizations like universities and colleges that are within our catchment areas. So we have kind of this big stakeholder group, and we meet with them once a month. And then we also have regular update emails. And a lot of what we've been doing recently has been a lot of sort of adapting our targets, so which pathogens we're monitoring, to meet the needs of state and local health in particular, as well as other public health groups. And so in those situations, for any kind of new monitoring or new detection, we first alert local and state health departments, and then as well as the wastewater treatment plant folks for any sort of new developments. And we do also have a public and also a private dashboard for stuff that's sort of in the works and pathogens that are getting developed. So the public dashboard I linked before, but we also have a private dashboard for our state and local health department partners, for them to kind of see everything that's sort of in the works as we go. And so to just kind of talk a little bit about some sort of vignettes or examples to kind of get us started on thinking about this. We do, because we do a lot. It's funny to talk about this here because, we've got like folks from SCAN and all of this, many of you do this on a very big scale. So, I hope we can kind of talk about this in a minute. But, a lot of what we do, the regular wastewater monitoring that we do, some of that informs individuals and communities directly. The dashboards and things that we build, they get used a lot in like communications that come from the local health departments, that come from the University of Michigan. We have a feed that goes to UM for their dashboards for public health, those kinds of things. Some of our regular monitoring informs, for instance, cleaning practices in residence halls. So the norovirus monitoring that we do, they use that to inform when they should change cleaning practices in residence halls. And so there's a lot of stuff that comes from sort of regular monitoring that informs public health practice in some ways. And so in particular, I like this one as like a fun little example. There's a group of like churches, religious organizations. There's the one person who sort of coordinates a couple different religious like community orgs, and asked for if we could have some kind of infographic that they could put up on their doors to indicate whether you should mask that week or not. And so we developed this little automated infographic that for all of our sites says, for SARS-CoV-2, what is our status? Are we in a decline or an increase? What's the projection from our models, and what does the data look like right now, that you could sort of like print out like a little card and put it up on doors. And so, things like this that sort of we do to try and be responsive to the needs of our community. But lately, a lot of what we've been doing has also actually been sort of in response to events. And so, and probably many of you are also encountering this too, and kind of thinking through this. So, we recently had 2 Hep A cases in Washtenaw County. And so the Washtenaw County Health Department asked if we could do wastewater monitoring to evaluate how their response efforts are going and to include in their social media communications. They also use SCAN data for this. And so we used, they were able to, we started, monitoring for hepatitis A. They were able to actually use the wastewater data that we were were providing to help them evaluate the extent of spatial spread based on where the cases were. They were concerned that maybe there might be positives in Ypsilanti if there had been spread. And so we were able to kind of look at both the Ann Arbor site and neighboring sites and see that, okay, we saw an increase in Ann Arbor right around the time when those two cases happened, sort of as expected, but then we did not see an increase in any of the neighboring locations, which was sort of, helpful for them to kind of be able to evaluate, did anything, do we have a bigger problem than we think? Those kinds of questions. Oopsies, sorry. And so, that kind of stuff where we're asked to turn on monitoring in response to a situation has been something that's been happening more and more. So we have had this happen a couple times with Mpox, where we had paused Mpox testing for a while due to sort of lack of activity, and we could kind of keep track of it through other sources like news and scan. But we have had a couple times where we've had an Mpox case detected by a local health department. And so they would request that we resume testing to kind of track the wrap up. In the one case that I'm thinking about here, the health department didn't have contact with the person, and so didn't really know whether there might be more extensive spread. And so it's often been really helpful for health departments, I think, to be able to ask us to turn on monitoring for things that they're dealing with so that they can, as just an additional check to see, they're trying to, they're doing all of the case investigation and all the stuff that they would normally do, and they want to just make sure that they've got a handle on this. And so, that has been something that I think we've been seeing kind of more and more of this kind of, hey, we have a case of X. Can we, start monitoring for that and make sure that, we've got this. And so right now, we've been thinking about this in the context of measles in particular. So, to be honest, I mean, like, measles is one of those things that, even though we've been dealing with it now in many places across the US, we've kind of been like knowing this one was coming, right? So childhood vaccination rates dropped since the pandemic, and the coverage levels in Michigan are at their lowest in over a decade, with more than half of Michigan counties now below sort of 70% for the major childhood vaccination series that includes measles, mumps, rubella, Tdap, and all those other kind of major ones. And so, we're at a high risk of outbreaks for some of these kinds of things, particularly measles, given its high transmissibility. And so, we've seen 5 measles cases in Southeast Michigan, and we had already sort of been working on primer probes at the request of public health officials. And so now we've started to really expand that work. And so, we've had negative results so far with the standard primers, but there's some concern that maybe some of the cases may have some issues with the match between the primers and those particular cases. So we're looking at some alternate primer probe sets. But anyhow, so I think these are just sort of some illustrations of the kinds of ways that wastewater, at least locally for us, has been getting more use and has been more actionable, has been actionable, I guess, thus far. But I think there's still sort of a lot of questions when we're working with local health departments, when we're working with the state Michigan Department of Health and Human Services around how do we interpret wastewater? How do we understand what is it? Like how many cases, how many people does a particular concentration mean? How many, how do you compare across locations? If I see a high concentration here versus here, what does that mean? Those kinds of questions. And trying to think through sort of like, how can we make this data as usable as possible in public health practice, and sort of what is needed to make wastewater data as actionable as we can. And so in talking about that, I sort of wanted to kind of put 2 buckets together for us to kind of think about today. To be actionable, data needs to be both interpretable and timely, right? So we have to have data that you can understand, that can answer the public health questions you're interested in. And for wastewater, I think some of the things that we all have been thinking about has been things like, is the data representative of the population we're trying to understand? Oftentimes you have particular sites and you're trying to use that to understand a county or a state. And so, is it representative of the population we're trying to understand? Is the data comparable across sites or locations? And is it interpretable in the context of other data? So how do we triangulate wastewater data with other clinical or epidemiological data sources to understand what's going on? And then the second question that I think is really important for us to think about, oopsie, sorry, my mouse is overactive, I should not touch it, is timeliness. So is the data actually available quickly enough to inform decision making? And so I think that's something that we also want to think about. So I'll touch on each of these in sort of a little way, and then hopefully we can talk more in just a minute. So for representativeness, I mean, so we did just a little bit of exploring just with the National Wastewater Surveillance System news. I think when we think about representativeness with wastewater, there's often a lot of concerns about the fact that, you know, unsewered populations are not going to be in the wastewater surveillance system. What does that mean for our ability to capture smaller, you know, less dense communities, rural communities, those kinds of things? If you look at the sort of county populations for all the different news sites that have updated their data since, I think, November 2023. So it actually is not as, I don't know, it's hard to tell. You can see basically from this that this is just a histogram of the different sites and what their populations are. We need to compare this to the overall distribution of counties and what their populations are, but you can see there are actually quite a lot of smaller counties that are included in news that are less populous. And if you look at urban-rural designation, so this is using the sort of like CDC urban-rural from like most rural, sort of non-core to most urban. You know, there's a skew towards urbanness, but it's actually not as skewed as at least I think I would have expected. Like there is a fair amount of rural stuff that's getting captured in news right now. And so that I think is kind of interesting. If you look at social vulnerability in the National Wastewater Surveillance System, that I actually was kind of encouraged by. You know, we are not, this is a distribution of, for every site in the National Wastewater Surveillance System, if you look at what county or counties it's in, what is the social vulnerability index of that county? So the social vulnerability index, probably people are familiar, but if you're not, it's an index that's made of 16 different variables across sort of 4 themes around socioeconomic status, access to transport, all sorts of different transportation, housing, all sorts of different variables that come together to make a percentile index that says how vulnerable is this county as a whole in a big picture way, from least vulnerable to most vulnerable. And you can see that we actually cover a pretty good spread of, you know, that looks like a decently sort of flat distribution across things. So I think that's an encouraging thing to see. When it comes to interpretability, and across different data sources, I think actually in the interest of time, I'm going to skip this, apart from saying that it's complicated and we want to be really comparing with many. This is an example from norovirus, where we were taking syndromic data, outbreak data, a bunch of different things, and trying to understand how does wastewater compare to all of these different kinds of data. And one thing that maybe we don't give enough love to is that search trend data can actually be kind of an interesting topic, an interesting comparison point there. I think it's tricky for interpretability because many of the situations where we want to use wastewater are exactly where we don't have a gold standard of existing clinical or public health data. And so I think there's a lot of work that we're going to need to do in terms of thinking about how we make wastewater data interpretable and how we triangulate it across different data sources that are already out there. But to make sure we have enough time, I really wanted, no pun intended, sorry, I really wanted to talk about timeliness of data. And so I'm going to use my last couple of minutes to talk about that. So how old is the data when I look at the dashboard is sort of a really important question that I think we want to get to when we're thinking about actionability. So we lots and lots of studies, ours, other people's, have shown that you get really good correlations between wastewater and public health data for a pretty wide range of pathogens, often with a lead time for wastewater, depending on the pathogen. And so we've seen that again and again for lots of different pathogens. But those retrospective analyses are really meaning that both data sets, the clinical or epidemiological data and the wastewater data, are presented in their most complete, curated, nicest form. And so what did the data look like live as you would actually be responding to some kind of infectious disease event like an outbreak? And so I want us to look for a moment at data lag. So this is going to be the difference between the date that we're going to use the dashboards as our example here, the date the website was checked and the most recent data available. So in other words, if I check the dashboard, whatever dashboard it is today, right now, what is the most recent data available to me? And is the most recent data available to me right now close enough to now that I can actually use it to interpret what's happening and make decisions. And so we did this for 4 different data sources. We just basically, I say we, I mean really my data analyst, we did some of this we did with scraping. Some of this though was just physically going and checking. So daily checking basically for 4 different things. So for our data, it's easy enough to track. What does a small university laboratory look like in terms of data lag? A state government wastewater dashboard, the National Wastewater Surveillance System, and a large privately funded wastewater program, the SCAN program. Well, in part, I mean, it's also publicly funded too. But so we checked this idea of data lag, meaning how old is the most recent data from November 2023 to February 2024. And we basically just not looking at any of the actual data, but just what's the update frequency of each site. And so we looked at these things. I want to just note very briefly that just because whatever lags we look at here are just the dashboard. There are lots of other ways to inform public health. And so this is not saying anything about what local health departments knew at any given time. So I just want to kind of emphasize that just because the dashboard lags doesn't mean it's not actionable. But I do think a lot of organizations, schools, community groups, healthcare use the dashboards as their primary route for gathering information. So I think it's still a relevant metric for actionability to explore. So if you look at this, here's what you get. So our lab and SCAN seem to have shorter lags from sample date to posting. Basically, if you look at the dashboard, your most recent data is more recent. And what's probably versus a state dashboard and the National Wastewater Surveillance System dashboard. And what's probably happening here really is that wastewater networks that go directly from plant to lab to dashboard, they have shorter data lags, right? Because it can go directly. Whereas networks that are relying on other systems to feed in, right? They have to wait. And so that is sort of a thing that I think we should look at more. I'll wrap up now. You can look at this broken down by site and see different patterns there. You can look at this broken down by state and see some interesting patterns in how different states are how variable they are in reporting. But just as my last slide, I did want to note that it looks like, though, if you look at these data lags, that they actually don't depend on social vulnerability, which I think is actually really encouraging. At least they may not be, like in some of these cases, you're looking at data lags that are more than 2 weeks, right? So like that's probably not super actionable, but it's not differential by social vulnerability, which I thought was an important point to note. But so I guess the point here is basically that I think one thing we should be thinking about as a community is how quickly we get this stuff up. Because if you want to actually be able to inform decision making, probably things in this like 2 weeks all the way this way kind of direction, it's too late. The situation on the ground has probably been changing, right? And so just something for us to ponder. And with that, I'll say thank you to everyone who worked on this, from state and local public health, wastewater treatment plants, our collaborators, of which these are just like the first 5, and there are many, many others, and our funding sources. So I'll wrap it up there.
Thank you, Marisa. I'm so grateful for all your hard work on this topic, especially given that you're an epidemiologist. So thank you for all of that. we need more people, I think, in epidemiology working on this topic. So there's a lot of questions, and I will start with two questions in the Q&A that are sort of related to adding new targets. So adding new targets to be responsive is a really valuable thing, as you said, that we can do when we're doing wastewater surveillance. But how do you balance that against sort of the usefulness and need for historical data? And what are your thoughts on that? And how long does it take, do you think, to do this on-demand wastewater surveillance?
Okay, great questions both. I think so. We try to keep basically sort of some things we keep going all the time no matter what, and then we have kind of some buckets of like flip it on, flip it off as needed kinds of things. I think stuff that is mostly not around but will show up as an outbreak, like measles or that kind of stuff, tends to be the kinds of stuff that we're more sort of turning on and then perhaps turning off again. Mpox, we've paused after it sort of seemed like we were not getting hits for a long time. And so we kind of, we'll turn that off. But I do think it's really hard because there's so many pathogens, have a big under the iceberg thing of asymptomatic that we may not even know about, right? And so I think it's very hard to balance those things. I wouldn't say that we have a perfect answer. It's the constraints of resources and you do the best you can. I will say that for adding new targets and how long it takes, that has been a challenge for us in terms of getting, how long does it take to figure out, to test your primer probes, make sure everything works, get it rolling. If you start that when the first case of something happens, you're often really kind of trying to constantly play catch up. And so what we've ended up trying to do, there are some things that they're going to be coming, right? So measles, we have low vaccine coverage for measles in some pretty good sized clusters in Michigan. That's a super transmissible thing. It's definitely coming, right? Hep A, Hep C, there's a bunch of these so we've had a couple times where we'll do these meetings with our local health department folks and with some of the state, Michigan Department of Health and Human Services folks, and just sort of talk over our targets and say, what should we get ready to go and just test out the primer probes and see if we can make sure we have something that at least we know what to order and what to do if when it hits. And so that, I think, at least for a lot of things, has been something good, but it's not always possible. I mean, H5N1 right now, it's you have to just kind of respond to what it is. So, it's tricky. Yeah.
Thank you.
Yeah.
Okay. I think we have time for at least one more question, which is, Marisa, what do you think about using wastewater surveillance for diseases that have really poor clinical surveillance or have a lot of asymptomatic cases where there's just really bad records? How do you think about, as an epidemiologist, sort of validating wastewater surveillance for those sorts of things, which might be most important things to surveil in wastewater? What are your thoughts?
Okay, so this is one of those things that that bucket of pathogens is sort of one of the ones that I'm most excited about wastewater surveillance for, because we have no other way really to get a good handle on it at the population level. And so that feels very useful as a tool, but like you say, then validating is such a challenge. And so here's where I think actually connecting with cohort studies, like CDC cohort studies and things like that, would actually be a really good thing to do. We've been doing this a little bit with some of Emily Martin's cohort studies, where she's trying to target recruitment from the sewer sheds that we are tracking in, so that way we can actually compare those two things. And so even if you don't have broad scale public health surveillance for a lot of these things, there are often cohorts that are being funded for particular locations that do exist. And so that, I think, is probably going to be sort of our best bet. It's that and syndromic data, right? Those are probably our two main options. So either symptom based or these cohorts feel at least those feel like the two things that I would probably start with. Yeah.
Great. Thank you. Okay. I think we actually have time for one more question, which is, I'm curious what you think about sort of the research to actionability timescale, because I feel like in wastewater surveillance, that timescale has basically gone to zero in some cases. And it seems like it's asking a lot of researchers to like have their like research from yesterday be actionable to the nation like tomorrow. So what are your thoughts on that sort of spectrum and from research to actionability?
It's been a wild transition since the pandemic, right? Like it went from an incredibly slow timescale to like, okay, you're flying this plane, now build it, and then now I think like the thing that's tricky is that like I think like public health practice has sort of recognized the usefulness in some ways of having this network of wastewater researchers who can turn things on quickly. And so I think that is probably going to continue, that those asks are going to continue. And I think that like we have to sort of think through a lot of things then. Like one, who should be doing that work? Is that academic work, or is that something else? Is that something that state labs should be doing? I think in many cases, like it's been beneficial to have academic partners in on that process, because I think it has like made possible some things to come together. Perhaps, I don't know. I mean, like in some ways more easily or quickly or adaptably than otherwise it might have. And so I think then in that case, if we are going to kind of keep having this rapid thing, I think like one, we got to think through like how do we make that sustainable for us, for academics, for researchers, so that that's actually doable? And two, like, are there other fields that we can maybe learn some lessons from? I think like, genetics, genomics, they have a lot of this same kind of thing where, researchers will be doing work and they'll be doing genomic testing on big studies, and that data just goes to surveillance systems. And there are database structures and things like that in place that let you say, this is provisional, this is, you know what I mean? Like that, where it can be used for action, but you don't have to be like, I am for sure that this is a positive for whatever, you know what I mean? Like where you can kind of still have some uncertainty, but let it inform action still at the same time. And so I think like those systems, we because we kind of got ourselves dumped into it during the pandemic, those systems haven't been built yet, but that's, I think, what we want to work towards. I don't know. That's my big thought.
Thank you so much, Marisa. We're out of time, but there are a couple great questions in the Q&A that we didn't get time for. So you might want to take a look at those. And Hesse, I think I'll pass it to you for Marlene.
Yeah. Marlene, do you want to share your screen?
Okay. Am I good to go?
Yes.
Okay. Okay. Hi, everyone. My name is Marlene. I'm going to be talking about detection of H5 influenza A virus RNA in municipal wastewater. And this is some preliminary work from a preprint that we just posted. So I'll talk about that, our process, and some of the outstanding questions that we all know we need to keep working on. So I want to start with just a little bit about the motivation and scope, sort of how we ended up here. As part of the wastewater scan program, we measure influenza A in every single sample. And the influenza A levels have increased in our data at some, and actually many sites in the nation, to higher levels at the apparent end of national influenza season. So we noticed that a little bit of an unusual pattern in some of the sites that are part of wastewater scan. Those increased levels are also concurrent with reports of HPAI outbreaks on dairy farms, and there was also one confirmed human case of highly pathogenic avian influenza. There's been quite a bit of conversation in the past about animal-related contributions of influenza to wastewater, because the influenza A assays that many of us use capture influenza A broadly, and that includes animal influenzas potentially. But in this case, the animal-related contributions of influenza to wastewater, we believe, are much more likely than in the past, because these outbreaks are happening in dairy cattle that contribute to the food supply chain. So it's quite a bit different from outbreaks that we've had of wild birds or even domestic poultry in terms of how they may sort of interface with municipal wastewater systems. So given the need to sort of understand all of that, we decided to retrospectively apply H-type assays to recent samples in partnership with some sites in Texas. And I'll explain how we arrived at the decision to look at those sites. And we designed, along with our partners at Verily, an assay to test for H5 for this project. I'm just going to briefly go through some of our previous work on influenza A, because I think it's important context for why we really need to understand the contributions of H5 to wastewater. So I'm so glad Marisa just spoke about this work that we all collaborated on with the University of Michigan. So this influenza A RNA in wastewater testing, this was the first time that we had done that in these outbreaks at and University of Michigan area and at Stanford. This was pretty early in the pandemic. And so these were some of the first times that we had seen influenza A come back after everything had been pretty suppressed due to those COVID measures. So these results were from outbreaks with really good case finding. And so you can see here, these are the concentrations of influenza A in wastewater over time. And then on the bottom here, these are the incidence rates in those two sewer shed associated areas. And there was a really strong relationship between the measurements we made in wastewater and what we saw in the case data. So this was some of the foundational work from our groups to suggest that influenza A monitoring in wastewater would be useful for understanding human disease. We've also done some previous work on influenza A subtypes. So we previously designed and validated assays for H1, H3, N1, and N2 influenza subtypes. The subtype analysis that we did in these sewer sheds in California at the time showed results that were consistent with subtyping of clinical samples. I'm not going to get deeply into it here, but I just want to point out this work because we were able to use these subtyping assays and find results that showed that N2 and H3, so H3, N2 were kind of the most commonly observed in wastewater and also most commonly circulating in terms of subtyping of clinical samples in the area. And this work was published in ES&T Letters. And based on, a lot of this previous work, we've been doing 2 years of prospective influenza A wastewater monitoring as part of the Wastewater Scan program. And so you can see here, this is the nationally aggregated data for influenza A normalized by PMMOV over the past 2 years. So we have quite a bit of data on influenza A in wastewater. And as we've had that kind of larger national network worth of data to work with, we've done work now showing that overall nationally, influenza A RNA tracks with positivity rates from Sentinel laboratories. And this information can be used to identify season onset and identify local outbreaks. So overall, we have found that over now several years that we've been developing using this data on influenza, it's been really useful for tracking human seasonal influenza outbreaks. So now enter HPAI more into the picture. Like I said, we noticed that there was this increase at quite a few sites online. And if you were, on social media, you might have noticed there were some other people out there who also noticed that there were some of these unusual increases in the data. We currently have 191 sites in 40 states that have regular influenza A monitoring. And so we looked at all the sites that had experienced sort of the offset of influenza season. And we have an algorithm by which we define offset and then followed by a new second onset. So that's a sort of unusual pattern where we had offset maybe and then onset again this spring. We also visually inspected the data for sites that had just a visual noticeable spike or increase. And overall, we found 44 sites in 18 states. This was as of about a week ago now, that had a second onset, and then an additional 15 sites that hadn't completely offset, but that had what we thought to be a notable visible increase. Out of these sites, we selected sites that had particularly high increases and that were in or near areas with cattle HPAI outbreaks. So this figure just shows you some of the sites with unusual increases. So this is from that preprint. Not all of these were ones that we selected for further testing for H5 specifically, but it illustrates the way that we are seeing this pattern beyond some of the sites that we actually did further H5 testing for. I'm just going to keep going for the sake of time, but I'm happy to come back to some of these. So we selected 3 utilities to work with more closely on H5 testing, again, based on that criteria. So 2 in the Amarillo, Texas area. So this green dot up here in the Texas Panhandle. Those sites provide 24-hour composite influent samples and serve 140,000 and 60,000 people at the 2 utilities. And then 1 site in the Dallas, Texas area, right near this big green circle. And they provide solid samples from a primary clarifier, and that utility serves around 186,000 people. These are all reported separate sewer systems, so they're not expected to have any environmental runoff or flows. And actually, all of the sites have reported that there are dairy processing industry sites that are permitted to discharge into the sanitary sewer system. The Amarillo plants have also reported that there are beef processing industry sites that are permitted to discharge. This is a little bit of a timeline. Again, we're looking here at the overall influenza A concentrations at these 3 sites. And then the dark black line is the overall national average. And we've superimposed a bit of a timeline here. So you can see February 8th is when the USDA declared an ongoing HPAI poultry outbreak. And then March 7th is when we saw an unknown dairy cattle illness first reported, sort of publicly reported. March 20th is when samples were collected from dairy cattle in Texas. And then March 25th was when Texas confirmed H5N1 as the cause in dairy cattle. Then the 28th was when there was a positive H5N1 specimen collected from a human. So you can see that although this spike happens a little bit earlier at one of the sites in Amarillo, the other 2 sites do show an increase right around, this is all happening in this time period of the reported HPAI outbreaks. And these levels have been very high. So the recent measured values are at the high end of the distribution. So this is the distribution of samples that were positive in the last year from all of the wastewater scan sites in terms of copies per gram. This is log scale. And what you can see is these 3 dashed lines represent the maximum value that we saw in these 3 utilities in the past 2 months. So these are very high values that we're seeing in wastewater, again, sort of at an unusual time. Okay, so I'll talk about our methods a little bit now. So we did design a new assay to target H5 specifically. And then we are also using the Influenza A assay that's described here. It's CDC's SARS-CoV-2 flu multiplex assay design that targets the M gene and should pick up all circulating influenza A virus. The H5 assay targets the HA region of the genome, and it was designed based on 7,000 sequences of H5 from 2006 to 2023. And then it was also, we confirmed the match based on 13,000 sequences from GISAID in the past year. So the primers and probe have a perfect match to about 90% of all circulating H5. This is all H5, so that could include HPAI and LPAI. And it is not specific to H5N1. It's inclusive of all H5, but it does include the circulating clade of HPAI in cattle right now. This is just to show you the alignments. This is the pan-influenza alignment for that assay for influenza A overall. And then this is the H5 alignment against NCBI sequences. So I know that's a little bit hard to look at quickly, but those are the alignments. Okay, so then we tested for specificity in silico and in vitro. So again, the assay is expected to detect 90% of H5 influenza A strains. And then this is a list of targets that we tested against in vitro to confirm that there was no cross-reactivity happening. And we did not see any cross-reactivity in vitro with any of our, test for H5. We analyzed the solids from wastewater using digital droplet PCR. And so we used biobanked nucleic acids that were extracted from the wastewater solids for this analysis because we had those biobanked as part of the regular ongoing wastewater scan program. So this was a retrospective analysis. And now on to the results. Okay, so these are the results here on the right. So we have the North utility and the South utility in Amarillo, and then the Dallas County utility. And what you'll see here is that the green triangles are the influenza A M gene concentration, so the all influenza A marker. And then the pink circles are the H5 specific marker. The concentration in gene copies per gram of wastewater is on the y-axis, and then time is on the x-axis. You can see this is from the beginning of February to the middle of April. Again, these samples were run retrospectively, and an open circle or triangle is non-detect and a filled in is detected. So what you can see here is that we had some detection of influenza A overall, pretty, still happening at all of these sites when we started with H5 testing. But H5 was detected beginning first at February 25th was the first sample that was positive at the South utility. And then March 11th was the first sample that was positive at the North utility. And we see these concentrations of H5 begin around the time period of the cattle outbreaks that are known to be existing in the region. And we see pretty consistent detection after that time. Also, the concentrations that we're seeing of H5 here are pretty high again, and they are very similar to the overall concentrations of influenza A. So, we would therefore infer that most of the influenza A that we're detecting in wastewater does have that H5 marker. All of our quality controls, all of our positive and negative controls were as expected. So now I'm kind of bringing it back together with the timeline of those overall influenza A concentrations that we've been seeing in the regular data. So you can see again here the concentrations of influenza A overall in each of these 3 sites. This here shows the emergency department visits per week of influenza in the 2 public health regions that these sites are in. And what you'll notice is that there has not been an apparent increase in ED visits related to influenza in the region, although there has been this increase in influenza A in wastewater. And then down here, this is a heat map showing detect and non-detect of H5 in the 3 different sites, again, the North utility, the South utility, and then Dallas County. And you can see again on this timeline, I know the dates are like a little bit small here, but you can see that there is an apparent increase in detection during this time period when the outbreak in cattle is identified and begins along with these increases in concentration. So the first detection in a wastewater sample was in a wastewater sample that was taken over a week before cattle illness was reported, and actually was a month prior to H5N1 confirmation. So we think this represents, or would have, if done in real time, pretty early warning of H5 in wastewater. Okay, so to wrap up, what does this mean, of course? So the presence of H5 indicates that contributions into the wastewater system include excretions that contain influenza viral RNA with an H5 subtype. So again, that's the extent of the specificity of the assay is to the H5 subtype overall. The results also do not tell us what species these contributions come from. There's a lot of contextual evidence that I think we can use to help us understand what is likely, but we can't tell directly from the testing what species the contributions come from. Our leading hypothesis is that dairy contributions are driving the high concentrations observed, but that doesn't exclude the possibility of other sources or other species shedding into the wastewater utilities. We know that H5N1 is shed in milk. It's been found even in pasteurized milk on the shelf, and these utilities all have dairies in their service area. And I think it's important to distinguish that these are not farms. These are not farming operations. These are dairy processing facilities that are part of the are part of a food supply chain, right? And so they are permitted to discharge byproducts into wastewater like whey in the production of milk. And that is normal, expected within the scope of their permitted work to be issuing those discharges into the municipal wastewater system, and does not likely represent any farming contributions or dumping of milk that is presumed to be from infected cows. But it's an important ongoing source of contribution to wastewater systems that it's really important for us to understand, given that we have an HPAI outbreak now that does include contributions from animals that are more likely to end up in municipal wastewater systems than before. So some of our future work, and work that I'm sure many people are interested in doing, will focus on further characterizing inputs into the sanitary sewer systems and also further characterizing the virus in wastewater. Finally, key takeaways. So municipal wastewater can provide an early warning for animal-associated outbreaks likely to have contributions to wastewater. I think it's important to note sort of the extent to which the samples that we went back to contained valuable information about H5 in the communities before that was available from other sources of information. So I do think that this work suggests that there's a lot of value to an early warning system. In some cases where it's appropriate and reasonable to make those measurements and associate them with animal outbreaks in municipal wastewater. I think this also points out that rapid response is really important to both provide situational awareness on new outbreaks. We felt it was important to share this information as soon as we were able to, because it does have bearing on an ongoing outbreak response, but also to explain any changes that may result in existing data, even without an interest in pursuing an understanding of the HPA outbreaks in animals through wastewater. What we've observed is an impact of those outbreaks on the influenza A signal in wastewater that has altered it in a way that does not seem to be reflecting human disease in those areas. So it's really critical that we are able to rapidly understand and interpret that change. And so I think also typing influenza in wastewater is therefore increasingly important to help us interpret wastewater data for human influenzas and then likewise animal influenzas. And then lastly, I think it's very important for us to further define expected non-human contributions to wastewater. Our municipal wastewater systems are primarily human input. And again, we don't believe that there's really farming activity that's happening in most of these municipal wastewater systems. But when we have a close interface between humans and animals, when there are food systems, et cetera, where there is that interaction that is expected and that contribution into municipal wastewater, we want to make sure that we're understanding that and other industrial inputs that we can be aware of to interpret both the H5 data that we have now and then also prepare for ways in which that information could be important for possible future outbreaks. So that's it. This is the QR code for the medRxiv preprint. And I just want to acknowledge all the co-authors on this work who have worked really long hours over the past couple of weeks to make sure that we could share all of the details of this information and the solid science behind it and take questions about it. The entire Wastewater Scan team and all the public health and utility partners in Texas, Amarillo, Dallas County, we incredibly appreciate how our cooperation has allowed us to get the best information we can to interpret and work with this data. So thank you.
Thanks, Marlene. That was excellent. We have a lot of questions and I have my own, but I'll try my best to get through as many of these as possible. First off, I guess, yeah, this is kind of in line with something I was wondering, which is, what is the role, do you think it's primarily the role of private companies or academic researchers to target these emerging threats like H5N1? Or do you think CDC's platform could ultimately implement these targets more rapidly?
Yeah, I think that's a great question, and I'll try to talk for like 1 minute instead of 20 about it, because I'm sure that we could all have a long conversation about what the best ways are for us to respond to emerging situations and from within a field that is still emerging as well. And I think Marisa's comments were also, I think, really helpful on this topic as we think about how we share data and talk about this work and put it out for new and emerging things. I will say, as academics and with an academic-led program, which is what Wastewater Scan is, I think it's our job to be investigating and understanding new things. I really think it is our mandate to create new information, right? To create new tools and to share those with the broader scientific community. I know that there are others who share pieces of that mandate, but we do so much work with public health partners whose mandate is not research, right? I know that the mandate of our public health partners is the protection of public health, right? First and foremost. And so I think we have a responsibility as academics and I guess probably others in industry and such as well to do work to drive the field forward and to provide information to our partners in public health and work closely with them to assist in that information being used as appropriate for public health response. So it's not my job to use this data, right, for public health response. That's not within my mandate. And we've been very careful to communicate with all of the public health stakeholders who we know this information impacts to make sure that we can, prioritize their needs and also get the critical information that we need to be doing good science and good research. I think that the academic, public, private partnerships around wastewater are going to continue to be important because we have slightly different mandates and because we have, slightly different approaches. But I absolutely think and believe that the news system can incorporate these things that we're learning together and working on together. And I hope to see that we will continue to work towards ways that we are, have pathways for that information. And, the news centers of excellence have been an awesome way for a lot of folks to be contributing to news's mission on that. So, yeah, but without speaking for them, I would say, yeah, of course, I think that integration and partnership is a really critical piece of all of this.
Yeah. So switching back more in the weeds here, are you performing any sequencing of these positive samples? And if you what's your approach for doing that?
Yeah, that's a good question. We're looking into it. It's complicated, not just technically. There are many technical challenges to sequencing in wastewater, but honestly, what is maybe more complicated is making sure also that we're following all of the necessary guidelines around identifying and characterizing these influenzas from a laboratory perspective. So Verily has been doing all of these samples have been processed in Verily's lab, and they're following all necessary regulations for handling and reporting and stuff related to this work. But there is kind of the technical piece and then also the regulations around work that centers on HPAI piece. So that's the hope, but I don't really have more specifics to share right now.
Okay. Are there other circulating strains of H5?
Yeah, so the primary one right now is associated with this outbreak. So it's challenging because some of the monitoring for other H5s that maybe LPAI especially are that information is a little bit more challenging to track compared to HPAI and particularly the current clade. So it's absolutely possible that there could be other H5s that are contributing to wastewater, but with what we currently know about sort of how much of this current HPAI clade is circulating and what the likely expected contributions to municipal wastewater are, I think it's most likely that the majority of what we're detecting is associated with that outbreak, but the test does not. That is situational, circumstantial evidence, and it is possible that there's other H5s that are in the mix.
Yeah. So I think this was really fascinating. I think it's really cool that you guys were able to do this, but you really benefited from all this retrospective data on influenza in order to kind of attack this zoonotic disease, right? And so I guess I'm curious how you guys think about if you're thinking about more trying to differentiate between zoonotic inputs, how do you do that for different types of diseases where you don't have the benefit of this retrospective data to dig into? You had this influenza line you could compare to.
Yeah, they're able to say something unusual.
How you guys are thinking about that? Yeah.
Yeah, I mean, I think it was the combination of something unusual is happening in the influenza A data overall, and also knowing, there by the time we started testing, right, there had been a reported HPAI outbreak. So I can imagine that, you know, there's a world in which we could say, you know, here's a panel that we want to run at a not so frequent interval of some diseases with potential zoonoses or potential introductions into new animal populations that would be likely to show up in municipal wastewater. And so let's you know, run a test for those every once in a while to keep an eye out. You know, that would be kind of one way of approaching it. But a lot of what we were looking at is not just that unusual influenza signal, but also knowing that there had been HPAI outbreaks reported in cattle in those areas. So I think either just casting a very wide net of thinking about what could be, you know, an important but rare and unlikely target to scan for occasionally, and knowing that we can be responsive to outbreaks that seem more likely to kind of end up in municipal wastewater systems. A combination of those can be really helpful. But definitely in this situation, I think something that gave us an imperative to need to respond and need to do some testing was the fact that that influenza A data has clearly been impacted by the shedding of H5 into the wastewater in you know, forms to be further characterized, you know, we hope. But that really gave us an imperative in this situation to need to, I think, do some further testing to understand what we were seeing there.
Okay. I am very sorry we didn't get to like half the questions in the Q&A, but I really appreciate your presentation. It was really interesting. I'm sure people can look up the preprint and contact you guys for any additional questions, because there's a lot that spurred. But yeah, thank you so much, everybody. And thank you, Marlene. I just want to be kind of cognizant of people's time here, but yeah, thanks.
Thank you. Thanks, everybody.